Okay, thank you all for joining us today for the Quad Cities COVID-19 press briefing. It is Thursday, June 18th. My name is Brooke Barnes with the Scott County Health Department. And joining us today, we have Janet Hill, the Chief Operating Officer with the Rock Island County Health Department, Edward Rivers, Director of the Scott County Health Department, and they are joined today by Anika Merton, the Community Relations Director at the Two Rivers YMCA, and Josh Whitson, Chief Operating Officer at the Scott County Family YMCA. First, we will hear from Ed Rivers with some case numbers as well as some opening remarks.
In Scott County today, the number of cases totals 418. The number of deaths stands at 10. The Scott and Rock Island County Health Departments have reduced the number of press briefings taking place each week. And we've done this because we're currently in a phase of the pandemic where we're not experiencing frequent changes. However, we would encourage you to remember these points. COVID-19 is still in our community. We continue to see positive cases, some among people who don't experience symptoms. Social distancing, or making sure you're more than 6 feet away from others who do not live inside your home, is still our best tool for reducing the spread of COVID-19. Testing continues to be available in our community through our health systems, private providers, and through the Test Iowa site. Just because businesses and other public places are open, this does not mean that COVID-19 isn't present. Protect yourself and others when you choose to go out and about. Events and activities in our community must continue to adapt in order to allow us to engage in the types of things that make us Quad Cityans, while also ensuring health and safety. We would like to reinforce that COVID-19 isn't going anywhere soon. However, we are resilient and can adapt as a community to ensure we can move forward and respond to any challenges related to COVID-19 quickly and safely.
Thank you, Ed. Next, we'll hear from Janet Hill.
Hi, everyone. We have 5 new cases to report, bringing our total to 791. Our total deaths stand at 28. The COVID-19 pandemic means that many of us are staying at home and sitting more than we usually do. Binge watching anyone? Regular physical activity benefits both the mind and body. It reduces high blood pressure, helps manage weight, and cuts the risk of heart disease, stroke, type 2 diabetes, and various cancers. All of these conditions can increase your risk to getting COVID-19. Leaders from the YMCAs on both sides of the river are here to talk to you about what you can do to stay active during the pandemic and what their facilities are doing to reduce the risk of COVID-19 when you visit.
Thank you, Janet. First, we're going to hear from Anika Merton with the Two Rivers YMCA. Go ahead, Anika.
There we go. I want to thank everybody for having me here today. It's been a crazy couple of months. Hopefully Josh and I can share some good news with you about things that are going on in YMCAs across the Quad Cities. The Two Rivers YMCA and Scott County Family YMCA are 2 separate associations and are in different states. And so it's really created a difference in the way that we are able to deal with the last few months. But I'm going to give you updates from the Illinois side with the Two Rivers YMCA. Our goal has continued to be serving our community and members in a safe and healthy way while following the Illinois state mandates. On June 1st, we were able to implement our first of a 3-phased plan for our reopening, and our phase 1 aligns with the Restore Illinois phase 3. Currently, we are able to offer one-on-one wellness sessions, outdoor group exercise classes, which are limited to 10 people or fewer in each group, and strategic lap swimming times in our pools. We're also running our regular programs of summer day camp, our Nourish Food Program, our Golf Learning Center, and Bass Street Rowing Center are also open, but that doesn't mean that everything looks the same as it did before. We've put a lot of new procedures in place with the reopening. We do have a wonderful membership app that we've been able to utilize while making the one-on-one reservations, as well as people being able to claim their spots for those outdoor group exercise classes. Doing it this way has kept it very organized, and it's guaranteed that we do not exceed our capacity limits and no one is turned away upon their arrival. We also found a lot of excitement in bringing back our group exercise classes. We have 8 to 9 classes a day during the week and are also offering some weekend classes. Excuse me. Currently, we are offering Les Mills, yoga, cycling, and more. We've had some wonderful feedback from these participants. Some have voiced their unease with going back inside of the building for classes, so they are loving this outdoor option that we have. We even had a few members who were apprehensive about the new procedures and getting back out into the world. So they had considered canceling their memberships, but after trying a class, they were highly satisfied and happy to reinstate their membership and are now regular participants. And regarding the one-on-one wellness sessions in the building, we have been able to allow participants back in our wellness centers during the one-on-one sessions. Not only are they getting great customer service with the one-on-one attention, but they are also being trained and reminded about the rigorous cleaning procedures that we have in place. Our CEO received a phone call from a long-term member not long after our reopening. He had participated in one of the one-on-one wellness sessions, and he complimented the new procedures, saying that he was very impressed with the plan and the sanitizing, and he said he felt safe during the entire time he was in the facility, which really meant a lot because we put a lot of thought and planning into the reopening. We have found that, yes, members are excited to get back to the fitness, but more importantly, people are just excited to be back together. It's not just about the fitness with the why, it's the support of those around you and a sense of community and togetherness. People have been isolated for so long, and seeing friendly faces is really brightens spirits with everybody. Looking forward, while we do not have all of the specific details for the Restore Illinois Phase 4 that will affect us, our Phase 2 reopening plan will align with Phase 4 of Restore Illinois, and it will look to expanding our offerings, our program, and our capacity limits. Currently, you can find all of our Phase 1 details on our website, and we will be releasing Phase 2 very soon. The last few months have certainly been a time for thinking outside of the box, and many places, including both us at the Two Rivers YMCA and the Scott County Y, worked really hard at providing some at-home options while the facilities were closed. And luckily, I don't know if luckily is the right word, but luckily, the COVID-19 crisis happened to coincide with springtime in the Quad Cities, and so many people have had a renewed love of being outdoors. And to promote that and support that, we do offer kayak and stand-up paddleboard rentals at our Bass Street YMCA location in downtown Moline, all of which are thoroughly sanitized between uses, and they can be reserved on our app. And I think that's all my updates. Thank you.
Thank you, Annika, for sharing all the ways that the Two Rivers Y is adapting during these times. We appreciate that. Next, we'll go ahead and have Josh Whitson go ahead. Please, thank you.
Okay, well, thank you, Brooke. I appreciate it, and thank you for the opportunity to be on the call today. Want to talk just a little bit about all the safety measures that were put into place prior to us opening up, and then continuing as we learn more and more each day. But we were able to open our facilities up on May the 18th. And in preparation of opening on the 18th, we went into all of our facilities and spread our equipment out as much as possible, 6 feet or greater. And for the facilities where that just wasn't possible, we put up signs that basically says this machine is practicing social distancing at this time. Please use the machine next to it, which would allow us to keep people spread apart 6 feet or greater, and would also allow us plenty of time to clean the machines properly in between use. We added additional hand sanitizer stations throughout our facilities, including a electrostatic disinfectant sprayer that allows us to go in and quickly disinfect our entire building in a quick manner. We've added increased cleaning throughout our facilities, including training on pandemic disinfection for all of our staff. And then at 2 o'clock in the afternoons, we go around and either rotate those social distancing signs, and then we do a complete sweep of our facilities as we go through and get those cleaned. We've increased all of our airflow in all of our spaces, including purchasing a 14-foot fan at our Bettendorf location to increase the airflow in our cardio room. We social distance spaces such as our group exercise studios. A lot of our classes, we've actually moved either outside or to our gym, giving us even more room to keep everybody socially distant as possible. We've added sneeze guards, the clear plexiglass that you see at our front desk as you go into any of our YMCAs. And here within the last week, we've actually added temperature checks. So as you arrive at the YMCA now, we actually have thermal scanners where you stick your wrist up underneath. It's able to read your temperature, and we're able to keep people safe in that way. We got a huge gift from our partners with John Deere in providing face shields for a lot of our staff as we look to add more PPE equipment for our staff. The face shields allow our program staff to safely administer programs such as camp, childcare, and swim lessons, as well as masks that we were able to put on our staff at the front desk. And then I would just say lastly, kind of looking forward as well, it's been a journey from May 18th all the way to today. We've definitely learned a lot, but we continue to see more and more people that are anxious to get out, start working out again, and start to living a healthy lifestyle physically. So thank you.
Thank you very much, Josh, as well, for that additional information. I apologize if there's some background noise. We have some construction going on here, so I'll try to be as clear as I can. We will now go ahead to questions that are in the chat. We did receive 2 questions ahead of time, so I will go ahead to those questions first, and then we'll go back to the chat. The first question was from WVIK. We have been doing some comparing of the percentages of cases and deaths in Rock Island County from long-term care centers in Tyson, but I don't have similar numbers for Scott County since there are no outbreaks there. Do you have any idea whether there are isolated or single cases or deaths on long-term care centers in Scott County, and if so, how many? So just to share, the information, as we've mentioned to you, on cases is released by the Iowa Department of Public Health, and we're only able to release the level of information that they provide. They have been providing information on outbreaks at certain locations if it meets the criteria, which would be 3 cases in residence in a long-term care facility. And Scott County has not had any in our community since the start of COVID. So we do not have any of that information to provide to you other than the fact that we have not had any outbreaks of that kind. So an additional question that we received was also from WBIK. I have a question that came up during our Disaster Ready Quad Cities, the former QC COED meeting this week. Agency leaders were noticing that so many of the new cases in Rock Island County are under age 50. They are speculating that this is because the bars and restaurants have reopened in Iowa, and anecdotally they reported seeing very little adoption of wearing masks and practicing social distancing. Does the contact tracing reveal trends that identify if this is the case in our community? And do they look for behavior trends in the contact tracing? Janet, can you respond to that question?
Sure. So we've noticed that there have been a lot of working age people on our list too. So when we've gone back and looked, almost all of them have been tied back to their essential frontline jobs. Tyson is part of that, but we're also seeing retail, healthcare, manufacturing employees on the list. Some of the most recent younger people are inmates at the East Moline Correctional Center.
Thank you, Janet. We do have a couple questions here for the why, so we'll probably start with Anika and then go to Josh if you have anything to add to that. I've heard that members were told they could not put membership on hold during the COVID shutdown. Did that end up being the policy, or did you credit members for time when Y facilities were not available?
You know, I think all Ys across the country were using different strategies to figure out how to handle the situation. We decided to put together a call team of some of our staff members, and they individually called everyone that was going to be up for a payment starting on, let's see, it would have been April 1st. We have our membership payments on April 1st and April 15th. So every time one of those payment was coming up, we had staff members individually calling everyone that was on that list. As you can imagine, that was thousands of people that were getting phone calls. So it was a lot of work, but we really think it was a great, not only a great way to reach out to members, but also they really used it as an opportunity for a wellness check. Some people just really needed someone to talk to because it really was a traumatizing time for everyone. And we were offering a couple options. We were offering a complimentary hold on their membership during the time that we were closed. Or we were asking them if they were able and willing that we could still draft their membership fees, only it would be used as a donation. And we had overwhelming support. We had about 40% of people who willingly wanted to convert their payment to a donation and support some of the things that we were doing during the closing, such as essential childcare for those essential frontline workers. And then anyone that needed refunds during the time, we just got them in contact with our membership team and they were able to take care of that. So I hope that answers your question on our end.
As far as Scott County, we sent out communication on March the 17th when the shutdown order came into effect. We sent it out via email, social media, and our website, giving the members options to put their memberships on hold for 30 days or a 60-day period, or they could cancel at that time. We also informed all of our members what we would continue to do during the shutdown, which would provide outreach services to our seniors and to our teens, as well as emergency child care for those that were in need.
Thank you. Ed, we have a couple of questions here for you. The first question, there has been an increase in positive tests. Is that attributable to any event? And is there more testing being done in the county?
I'm not sure what you mean by there's been an increase in positive tests, whether you're talking about Scott County or the state of Iowa, but in Scott County, our numbers are low. Since in the last 10 days, the number of cases per day reported by the Iowa Department of Public Health has been either 1, 2, or 0, except for the 10th when there were 4, and the 17th where there are 5. That's still an average of less than 2 cases per day.
Okay, and an additional question. Assumption High School did not follow social gatherings during a recent baseball game. Does the health department play any role in development of policies for schools? And perhaps you could discuss the recommendations for individuals who live in the same household as well as those who don't live in the same household.
The Iowa Department of Public Health publishes guidance for many types of organizations, businesses, faith-based organizations. That's where the guidance comes from. As far as household versus non-household, if one is in a household, one is considered to be in close contact with all the household members. We have been doing, as a part of our contact tracing, household contact interviews all along, but when you're talking about contacts outside the household, those people would not be, they would have to be told to isolate, whereas if you're in the household with a person, that would be a given. I'm not sure if that addressed your question properly or not.
Thank you. It looks like there's a question if we could get photos of Anika and Josh so we can work with them on that so that you may have those. And Janet, the last 2 questions relate to Rock Island County. Could you please tell us how many cases there are at the East Moline Correctional Center, and do the Correctional Center numbers include employees?
So the Illinois Department of Corrections has a website that has all of the information all across the state. And East Moline has 3 staff who have confirmed cases and 27 inmates, so a total of 30.
Okay. Looks like we don't have any additional questions, so we thank everyone for joining us today. This recording will be placed on the Scott County Health Department website. Should you have missed any information, it will be available there for you. And we do anticipate, as new information is available, providing it to you through a variety of means. So just be looking for additional information to come from the Scott and Rock Island County Health Departments. Thank you everyone for joining us today. We'll talk with you soon.